So what has now dramatically changed is we're getting older. And as we're getting older, because we don't die anymore from trauma and infection, it's like an old car, it starts to squeak. We have these chronic conditions that come up. And here we have a totally different relationship, because the person who has the biggest impact on my health when I have a chronic disease is me. If I don't do my diet, if I don't change my habits of working, of life, of sports, then even the best doctor and the best medicine will not have a big impact on how my health evolves over the years. And so suddenly the patient finds himself in a very responsible and very powerful position, whereas most of the medicine establishment is still organized around a very quick 10-minute visit in which you ask, tell, doctor decides, you go home and do. And so all of that is changing dramatically, and it requires very, very deep changes. Because today patients in general are not yet really listened to as to their needs by people developing medicines, and also in many cases by the whole treatment system. It's still very medically driven. What the doctor thinks is right is what is given to the patient. And what is beginning to change is that people realize it doesn't work. We have to ask the patient what's important for them, because that's the best way to fill that need. As we are growing older as a population, the first children who will become more than 100 years as a generation have been born already. We will face more and more these very important questions for chronic diseases, and that requires a dramatic change of the healthcare system. So there's only one way. The only way to find out what the patient wants is to ask them. But you have to change your mindset. Instead of just trying to find out what the average is and then finding a solution for the average, you actually have to explore how big the variation is. And then if you can make a solution for the extremes, you will get the middle for free. I'll give you an example. The first computers, which in my case was the Commodore 64, which was a very old computer, you had to know a little bit about computing and about typing to be able to have fun with that. But if the true IT people thought that it was for dummies, and the average people in the street could not use it. So it was made for an average group. Compare it to the iPad. A 2-year-old can play a game, an 82-year-old can use it as their window to look at the game, at the world. So by satisfying the extremes rather than the average, the iPad has taken the market. And you see that over and over, that when you actually are able to expand the range of people who find benefit from whatever it is you are developing, the more impact you will have. But that requires us to give up that almost dogmatic notion that we have to go for the averages. And if you look around us, when it comes to social security, education and health, a lot of the policies that we face as citizens of this world are still based around that average. That sits somewhere in a report, like the average Belgian woman is, the average Belgian man is, the average child is. That is no longer today acceptable,